First human SARS-CoV-2 infections occur. The first human cases of COVID-19 were identified in Wuhan City, China in December 2019. At this stage, it is not possible to determine precisely how humans in China were initially infected with SARS-CoV-2. However, SARS-CoV, the virus which caused the SARS outbreak in 2003, jumped from an animal reservoir which is civet cats, a farmed wild animal, to humans and then spread between humans. Similarly, it is thought that SARS-CoV-2 jumped the species barrier and initially infected humans, but more likely through an intermediate host, that is another animal species more likely to be handled by humans. This could be a domestic animal, a wild animal, or a domesticated wild animal and, as of yet, has not been identified. Until the source of this virus is identified and controlled, there is a risk of reintroduction of the virus in the human population and the risk of new outbreaks like the ones we are currently experiencing. Can COVID-19 be spread through coins and banknotes? There is currently no evidence to confirm or disprove that COVID-19 virus can be transmitted through coins or banknotes. However, respiratory droplets expelled from an infected person can contaminate and persist on surfaces. Wash your hands regularly and thoroughly after touching any frequently touched surface or object, including coins or banknotes. Avoid touching your eyes, mouth, and nose, if your hands are not clean. How can I grocery shop safely in time of COVID-19? When grocery shopping, keep at least 1 meter distance from others and avoid touching your eyes, mouth, and nose. If possible, sanitize the handles of shopping trolleys or baskets before shopping. Once home, wash your hands thoroughly and also after handling and storing your purchased products. There is currently no confirmed case of COVID-19 transmitted through food or food packaging. How to wash fruits and vegetables in the time of COVID-19? Fruits and vegetables are essential components of a healthy diet. Wash them the same way you would in any other circumstance. Before handling them, wash your hands with soap and water. Then, wash fruits and vegetables thoroughly with clean water, especially if you eat them raw. Is COVID-19 airborne? The virus that causes COVID-19 is mainly transmitted through droplets generated when an infected person coughs, sneezes, or speaks. These droplets are too heavy to hang in the air. They quickly fall on floors or surfaces. You can be infected by breathing in the virus if you are within 1 meter of a person who has COVID-19, or by touching a contaminated surface and then touching your eyes, nose or mouth before washing your hands. The timeline of COVID-19. On the 31st of December 2019, China reported a cluster of cases of pneumonia in Wuhan, Hubei province. A novel coronavirus was eventually identified. On the 1st of January 2020, WHO had set up the IMST, or also known as Incident Management Support Team, across the 3 levels of the organization: headquarters, regional headquarters, and country level, putting the organization on an emergency footing for dealing with the outbreak. On the 4th of January 2020, WHO reported on social media that there was a cluster of pneumonia cases with no deaths in Wuhan, Hubei province. On the 5th of January 2020, WHO published our first disease outbreak news on the new virus. This is a flagship technical publication to the scientific and public health community as well as global media. It contained a risk assessment and advice and reported on what China had told the organization about the status of patients and the public health response on the cluster of pneumonia cases in Wuhan. On the 10th of January 2020, WHO issued a comprehensive package of technical guidance online with advice to all countries on how to detect, test and manage potential cases, based on what was known about the virus at the time. This guidance was shared with WHO's regional emergency directors to share with WHO representatives in countries. Based on experience with SARS and MERS and known modes of transmission of respiratory viruses, infection and prevention control guidance were published to protect health workers, recommending droplet and contact precautions when caring for patients, and airborne precautions for aerosol-generating procedures conducted by health workers. On the 12th of January 2020, China publicly shared the genetic sequence of COVID-19. On the 13th of January 2020, officials confirm a case of COVID-19 in Thailand, the first recorded case outside of China. On the 14th of January 2020, World Health Organization's the technical lead for the response noted in a press briefing there may have been the limited human-to-human transmission of the coronavirus in the 41 confirmed cases, mainly through family members, and that there was a risk of a possible wider outbreak. The lead also said that human-to-human transmission would not be surprising given our experience with SARS, MERS and other respiratory pathogens. From 20 to the 21st of January 2020, WHO experts from its China and Western Pacific regional offices conducted a brief field visit to Wuhan. On the 22nd of January 2020, WHO mission to China issued a statement saying that there was evidence of human-to-human transmission in Wuhan but more investigation was needed to understand the full extent of transmission. From 22 to the 23rd of January 2020, the WHO Director General convened an emergency committee under the International Health Regulations, or also known as IHR 2005, to assess whether the outbreak constituted a public health emergency of international concern. The independent members from around the world could not reach a consensus based on the evidence available at the time. They asked to be reconvened within 10 days after receiving more information. On the 28th of January 2020, a senior WHO delegation led by the Director General traveled to Beijing to meet China's leadership, learn more about China's response, and to offer any technical assistance. While in Beijing, Dr. Tedros agreed with Chinese government leaders that an international team of leading scientists would travel to China on a mission to better understand the context, the overall response, and exchange information and experience. On the 30th of January 2020, the WHO Director General reconvened the Emergency Committee. This was earlier than the 10 days and only 2 days after the first reports of limited human-to-human transmission were reported outside China. This time, the EC reached consensus and advised the Director General that the outbreak constituted a public health emergency of international concern. The Director General accepted the recommendation and declared the novel coronavirus outbreak a public health emergency of international concern, or also known as PHEIC. This is the 6th time WHO has declared a PHEIC since the International Health Regulations came into force in 2005. On the 3rd of February 2020, WHO releases the international community's Strategic Preparedness and Response Plan to help protect states with weaker health systems. From 11 to the 12th of February 2020, WHO convened a research and innovation forum on COVID-19, attended by more than 400 experts and funders from around the world, which included presentations by George Gao, Director General of China CDC, and Zhongyue Wu, China CDC's chief epidemiologist. On 16 to the 24th of February 2020, the WHO-China Joint Mission, which included experts from Canada, Germany, Japan, Nigeria, the Republic of Korea, Russia, Singapore, and the US, spent time in Beijing and also traveled to Wuhan and 2 other cities. They spoke with health officials, scientists and health workers in health facilities. On the 11th of March 2020, deeply concerned both by the alarming levels of spread and severity, and by the alarming levels of inaction, WHO assessed that COVID-19 can be characterized as a pandemic. On the 13th of March 2020, COVID-19 Solidarity Response Fund launched to receive donations from private individuals, corporations and institutions. On the 18th of March 2020, WHO and partners launched the Solidarity Trial, an international clinical trial that aims to generate robust data from around the world to find the most effective treatments for COVID-19. In a nutshell, coronavirus disease is also well known as COVID-19 as an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission is to be well informed about the COVID-19 virus, the disease it causes and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes, so it's important that you also practice respiratory etiquette. At this time, there are no specific vaccines or treatments for COVID-19. However, many ongoing clinical trials are evaluating potential treatments. WHO will continue to provide updated information as soon as clinical findings become available. Share the video, subscribe the channel, and thank you for watching.